I am Dr. Vivek Gupta. I am Senior Consultant Interventional Cardiologist at Apollo Hospital, New Delhi. The most important features, which are 4 to 5 features which differentiate between a heart pain, that means angina pain, and non-cardiac pain, which is the non-angina pain, is that the pain of angina normally happens on the whole chest of the body. The whole chest is very important. A pain which is pin pricking, a pinpoint, which is never cardiac pain, is never angina pain. One important feature is that pain should be in a large area of the chest. It should not be a transient pain. Ideally, the pain which happens, which is coming as a fraction of second or fraction of 20-30 seconds only, is never heart pain. A pain of angina will always keep on happening at least for 2 to 3, 4 minutes or 5 minutes or maybe 10 to 15 minutes. Third important point which is differentiating between angina pain and non-angina pain is that pain of angina normally will occur or precipitated by exertion. That means whenever the patient walks about 2 kilometers, half a kilometer, 300 meters, 400 meters, or the patient does some sort of exertion, he picks up something, body weight or something, the pain which is happening after exertion and the pain which is resolving out, that means it is stopping after rest, is normally angina pain, while the pain of non-angina will not have this variation as such. Now, the fourth important point, which is very important, is that the pain, actually this is one important of angina. Normally people feel that the pain of the chest, which is on the left side, is heart pain. It is not true. Pain on the right side of the chest as well as on the left side of the chest. Sometimes the angina pain can be because on the throat, it can be in the lower part of the chest, it can be on the back. Sometimes the toothache, the pain in the tooth, sometimes is actually angina. So there are features which we have to see, that pain which is happening on exertion, the pain which is happening on the large area of the chest, pain which is happening for at least 5 to 10 minutes, pain which is happening associated with ghabrahat and pasina. The very important point is the pain which is happening associated with sweating or ghabrahat or patient not feeling well, that is normally angina. So a pain which is not angina, I will just tell you, a pain which is localized to one point is not angina. It's pinprick, not angina. Pain which is happening without any exertion, it is lasting for 24 hours, 36 hours, pain happening for last so many days, it is never angina. So pain and the pain which is happening with exertion, with large area of the chest, which is relatively feeling as with ghabrahat, with the sweating, is normally angina. But very important, this differentiation should be done normally by a cardiologist or a physician. The history is very important. When the patient goes to the cardiologist or to a physician, he has to tell that these are the features which are coming, and therefore we can differentiate between angina pain and a non-angina pain. It takes some time long. Sometimes it is not very clear. Even after a lot of things, lot of disturbances, lot of physician, they devote about 20-30 minutes, still they are not able to clear. Then we have to do some tests, and those tests are actually echocardiography, treadmill test or CT scan of the heart. The pain which is clearly angina should always be treated by full evaluation, and that normally involves an angiography. And if angiography is clear, that means there is no blockages in the heart. That pain that rules out any pain which is associated with angina. Therefore, TMT should not be done in a patient who has actually clear-cut angina. TMT is devastating. It can lead to sudden cardiac arrest or sudden cardiac death. Therefore, TMT should always be done when the patient is not clear, or when the doctor is not actually clear that the pain which is happening is actually angina or not angina. But once you're sure that the pain is of angina origin, one should never do treadmill test. The only confirmation that happens either with troponin test, which is a blood test, or second is coronary angiography, either by CT scan or by a regular catheter angiography. Further, of course, you have to meet your own cardiologist or a physician to further differentiate between a chest pain of angina or chest pain which is not angina.